Hi, Jamie Davis here from the Nursing Show at the ANIA 2016 conference in San Francisco. And I'm here with Sandy, who's one of the poster presenters here. She's here with a whole group of people that are really excited about nursing informatics. And I want to find out a little bit about what she has to say regarding her presentation. But first, Sandy, tell us a little bit about why you wanted to become a nurse.
I actually fell into nursing. As a Chinese female, my family always wanted me to be a doctor, but I also knew that the nurses were more in the forefront and at the bedside. When I fell into it, I realized that it had a breadth of opportunities. You can actually be on the inpatient side, on the outpatient side. You can be in so many different areas, and especially now what's so exciting is the technology side, which is near and dear to my heart. And so it's interesting that I fell into it, but I fell in love with it as well.
Excellent. So what drew you into informatics? I mean, you said you love the technology, but this whole field of nursing is still growing so fast.
Yes, well, as a floor nurse at the pediatric hospital at UCSF, I found that systems were okay, but I always felt like we can do it better. And I was from the generation of hand documentation and hand charting. I would always measure things like how long it would take for us to figure out how to read a physician's order. I would measure things like how many steps or how long it would take for me to get a medication. And I found that since I was so systems oriented and being in the heart of Silicon Valley, I knew technology was something that could help. And so my passion kind of stemmed from there. It also stemmed from my professor in grad school too. She was really hot and heavy in HL7 and making sure that we could transfer data and having the nomenclature correct so that we can share a lot of that data. And that really stemmed my interest in grad school. And from there, I just started to insert myself anywhere I possibly could at UCSF and try to grow. And now I'm actually in data and analytics.
So you're doing a poster presentation, you and some of your colleagues. What are you trying to find out, or what did you try to find out with the question you were asking?
Yes, so my co-presenters, hopefully, will be interviewing as well. We looked at data from our electronic health record. So we have a what is called an alert system or surveillance system, and so it actually trolls through all of the data real time and allows for them to receive alerts so that they can understand what patients might be at risk. My colleagues are actually the ones that help drive the different parameters that we wanted to look at. Well, they started implementing that more and more on different units, and the data just got bigger and bigger, as we all know, big data. And so it was getting out of hand, and they couldn't really handle it and analyze it actually as well as they wanted to. So they turned to technology, and they turned to me. Since I was helping to drive the dashboard and analysis, we were taking all of that data from not just the electronic health record and the alerts, but we were actually pulling the process measures. So what are people doing about that? And are they doing it in time? Are they compliant in all the things that were recommended that should be done? And looking at all of that in the bigger picture to analyze that. And so as a result, we created a great dashboard that they're able to monitor the entire adult population at UCSF. And they can take education and bring it back to the staff real time. It used to be that they had to wait 3 months before they could actually give education. And who can remember what the exact patient they took care of 3 months ago, right? But if you go back to them tomorrow, then you can remember fresh in your mind and hopefully drive that impact. And we know that as a result, we've been impacting our mortality. And so we're really impacting, deaths and hopefully survival at UCSF through a lot of the work that we do.
And it's amazing to hear you talk about how using informatics and using the data that we're collecting, we've got all this data, but what do you do with it? That you're actually actively using it to impact better patient care and impact better outcomes.
Yes, well, baby steps. Part of the challenge I think that I have in my role is that the data is often not as clean as we would like, right? So the quality of it really needs a lot of work. We understand, and I partner with a lot of my informatics folks actually with the workflows that actually are driving that, right? So we eventually want to enhance the workflows, understand the build and design of the EHR so that we can really get that good data out. But right now we're kind of laying that foundation so that we can actually analyze a lot more. And we're bringing many disparate sources together. So it's it's not just the EHR, it's bigger picture now. It's looking at the finances, and it's looking, at some of the peripheral technology, and really understanding how the bigger picture is so we can make that bigger impact and find those golden nuggets.
Excellent. One last question. You're here at ANIA. It's in your backyard, so that's kind of nice to have it close by. What is it about coming to this conference or conferences like it that are so important for the nurses involved in informatics? I mean, what recommendation would you make to somebody maybe considering attending next year's event?
I would highly recommend it. One, you have incredible value learning about new things, learning about how other people are actually impacting the organizations out there, and how you can take that back to your organization and hopefully be the catalyst for the change in your organization. The networking is absolutely priceless, right? Because you've got thought leaders here, you've really got people that are on the grounds from theory to actually operationalizing everything, and that way you can network in this intimate environment and really catapult yourself into nursing informatics the way that you would want to based on what you see and hear.
Sandy, thanks so much for chatting with me.
Great.
I appreciate it. And I want to thank all of you checking out this segment here at ANIA 2016. I'm Jamie Davis from The Nursing Show. Remember, all of these segments, the ones I've shot over the last 2 days, are available for you over at ania.org as well as over at nursingshow.com.